Welcome back to SA Live. Well, it's a problem that can be painful. Did you know that 30% of women in the US have bunions? Well, there's a new procedure to get rid of those bunions, a faster recovery. Here to tell us about it is Dr. Mark Allen of Sports Medicine Associates in San Antonio. Hey there, Dr. Allen.
Hello, everybody. How are you?
All right. Bunions can cause some pretty intense foot pain. What causes them and how are they formed?
Sure. Well, bunions are like a lot of things in life. It's a combination of your genetics that you inherit and the environment. Genetics is what your parents have given you, and they've given you the ability for your bones and your joints to move in such a way that sometimes the toe becomes crooked. Environment is something that most women are used to seeing, and that comes from the shoes in which they wear over a long period of time.
So before we get into this new method to treat them, tell us about traditional bunion surgery.
Well, traditional bunion surgery, the way that I was taught early in my career and the way that some of the teachings are still happening now, are meant to correct the very end of the bunion deformity. It's creating it's fixing what we tend to think is the part that hurts the most and looks the worst. And that's towards the very end of the foot. Our traditional way of fixing these is we cut that piece of bone, we shave it down, and then we move it over. But what we've done is we've made the toe straight, but the toe is still crooked in relation to the rest of the foot. So therefore, the reoccurrence rate tends to be very high, and in some cases, approaching 50%.
And the new procedure is called Lapiplasty. How exactly does it work?
It is a technique, and it's also instrumentation. But behind the Lapiplasty is a completely different way of evaluating what this bunion is. Never before have we started to look at bunions as being a deformity on 3 dimensions. We have notoriously looked at it and traditionally been trained to look at it on 2 dimensions and most commonly on 1 dimension. And so when we're only correcting 1 or 2 of the 3, this explains why the reoccurrence rate is so high. The new Lapiplasty procedure not only teaches us to evaluate the deformity different, to appreciate it differently, but then the procedure itself allows us to now correct this in all 3 different dimensions. The instrumentation allows for us to create a way to precisely, accurately, and reproducibly correct a deformity in all 3 planes. And if we get it right in all 3 planes, the chance of reoccurrence right now, what we're finding, is less than 2%. Another way to look at Lapiplasty, if you look at total knee replacements and joint replacements, we're now using robotics in joint replacement and spine surgery, or abdominal surgery. We're doing things differently. No one would think of having their appendix removed today by having a 5 or 6 inch incision.
Thank you so much, Dr. Allen. Again, for more information about the Lapiplasty procedure, visit alignmytoe.com.